Hi everyone, this is Neel Raithatha, consultant audiologist and director of WAXscope. Thank you for joining me in another demonstration video of our now released Waxscape. And here I'm using our medium-sized Specula, which is it's got an internal diameter of 4.25 millimeter. We've got a smaller one, which is 3.5 millimeters, and then we've got two larger ones. You've got your 5 millimeter internal diameter Specula size, which is meant for larger ear canals, and then you got your 5.75 millimeter internal diameter Specula for more surgically operated on ears. So if patients have mastoids, and for example, and the entrance of the ears is enlarged. So you can see this patient's got quite a few cilia. That tells you we're at the entrance of the ear canal, on the outer third at least, the cartilaginous portion. The wax is quite stubborn, so I'm just trying to leverage this out with the use of the new Rye Correct, which is also now, it will be available on the 12th of April. That's when we're going to start distributing and shipping any orders we will receive. So we're chiseling this out. So when you're performing earwax removal, it's really, really important not to be solely reliant on just suction, because quite often suction is not enough. I would say that I'm using instruments at least 50% of the time, and quite often in conjunction. So it could just be I'm using it partly during a procedure and not the entire procedure. But it is a skill that if you want to become a clinical ear care specialist or a ceremonologist, that you're going to have to acquire. It's not easy using instruments. It's a lot more tricky than suction because you're having to, with instruments, manipulate it inside the ear. You can get quite close to the canal wall, which is very sensitive, especially the latter two-thirds, the osseous bony portion of the ear canal, where the skin is less than 0.1 millimeters in thickness, and the skin is void of the dermis layer or the hypodermis layer, also known as the subcutaneous layer, which contains fatty tissue. And so the skin that lines the cartilaginous portion is 1 millimeters in thickness. It's a lot thicker, and it has those three layers of skin, those three ply layers, which acts as a buffer. But on the bony part, it's literally skin on bone, and that skin is very delicate, very thin. So instrumentation use is a lot more tricky. It is the case. But you do have to acquire that skill, because you will need it in certain instances. So in this case, I removed the outer part initially with the Correct, remove some of the remnants of that with suction. I've just put some oil in just to loosen this, because we're getting deeper in the ear now. I want to see if I can suction this, but I have a feeling I'm going to go back to the Rye Correct in a moment, which we'll see. And this patient is really, their symptoms are quite severe. It's a lot of otalgia, experiencing tinnitus, a ringing or buzzing noise in the ears, and I'm just trying to loosen. So the view with the Waxscope is completely different to the endoscope. You can't compare the two. Quite often I'm getting pointed out that the view is different. Well, I kind of know that because I developed the iClearScope endoscope as well, so I kind of know the difference, which is always a bit amusing. So I'm well aware it's a different view. But the reason for the Waxscope is a lot of people can't use the endoscope. So what good is the view if people can't use it? So there's a need for an alternative, and current alternatives don't really hit the mark. You've got head loops, which provide very low level magnification. I did share a video highlighting that, and I will in future as well. You've got an ENT microscope, which it actually in view is very similar to what you're seeing now. But with an ENT microscope, it's very difficult to train people to use it, because you are looking into binoculars, and a lot of people get double vision as a result. They're very expensive. They're not portable. So we're just going to remove that with the Rye Correct. Look at that view. We're just going to change it, get it in focus. What I did here as well, because the speculum has got a slit, and it can introduce some hairs. And when you look in people's ears, it's normally, so in the case of the left ear, which we just treated, the hairs are normally on the posterior part of the canal wall. So it can be at the tragus, but you go past the tragus, and then it's on the back part of the ear canal. So some of the hairs can get into the gaps, that slit that I was referring to. When you're using instruments like we are here, you kind of push them out the way, so it's not a problem. But when you then come to finally visualizing the ear, you don't obviously have an instrument there to push the hairs out the way. So what's great about the Waxscope is with the speculum, you can rotate it. So you can rotate it so the slit is on the opposite side. So once I clean this ear out, the hairs are mainly coming from the left-hand side. And the slit, I've got it about 1 or 2 o'clock. So the hairs, some of those hairs, they're coming from the top part of the ear canal as well, but mainly from the back as well. The ones that you're seeing here are tragal hair, so we go past that with the speculum, so they won't interfere. But I'm going to rotate the speculum clockwise towards about 3 o'clock, and you just don't see the hairs. So that's another great benefit of the Waxcap. The speculum is, when you attach it, you can either rotate it whilst it's on there. Sometimes it can be a bit tight to do that though. So you just remove the speculum, it's a push fit, and then you just put it in the angle you want and straight back in. So remove the majority of the wax. There's some keratin here, we're going to peel that away so we can see the tympanic membrane. So yeah, the ENT microscope, they're very expensive, they're not portable. The endoscope for me is still the best, it's far superior. So you can see here I've just rotated the speculum, so you're seeing less hairs, just getting it in focus. So the Waxcap has specifically been designed as the next best alternative really if someone is not able to use an endoscope, because I feel the next best alternatives at the moment are lacking in certain ways. Well, I hope you enjoyed that video. And if you are interested in the Waxcap, please email info@clearwax.co.uk.